All right. So, welcome everyone. Thank you so much for being here today. So, I'm really excited to welcome you to a new series that we have and that we're offering. And so, today kicks off the very first of a four-part series that Wellspring has partnered with OMPRN for. And so, I've got a sticky note here just because I tend to mess this name up and I want to make sure I've got it right. So, the Ontario Molecular Pathology Research Network. So, we've been working really hard on putting together a really informative series for you guys. So I'm hoping that today is a session that you will learn and take away a lot of really great information from. And so we've also got Dr. Harriet Verloiter here, who is the director of OMPRN. So I'm very pleased to pass over the mic to you, Dr. Harriet, to introduce a little bit about the series and our speaker for today.
Wonderful. Thank you so much. And I'm really happy to be here. And thanks to everybody who joined. So it's my great pleasure to welcome today's speaker, Dr. Kyster Nanan. He's going to tell you a little bit more about OMPRN and what it is. And he'll probably tell you a little bit as well about this seminar series that we have, which is a series of four seminars that are really designed to bring some of the concepts of molecular pathology in a more understandable format to a lot of different kinds of learners. So for today's talk in particular, Dr. Nanan, he is the project manager and the education lead for the OMPRN, and he's based out of Kingston, Ontario. And he plays, I would say, the key role in the OMPRN's educational mission. We have been doing a lot of educational resources for researchers, for healthcare workers, and also for patients and their partners and for the general public. And this has really been largely Kyster's doing. So Dr. Nanan has come to us with over a decade of experience in cancer research, but also with formal training in teaching and learning, and you're going to see that in evidence today. So he applies that skill set to making molecular pathology topics much more accessible to people and understandable. So for today, he's going to be guiding us through the first of the four sessions, which is called Where Does Cancer Come From and How Does It Spread? So please join me in welcoming Dr. Kyster Nanan. Kyster?
Thank you, Harriet, for the introduction, and thank you to Wellspring and all the folks in the audience for joining us today. Like Harriet said, today I plan to cover the basics of how cancer starts and how it spreads, why, and I'm going to talk also about why early detection is important and how all of this connects to the larger field of molecular pathology. At the end of this talk, there's going to be some time for questions. There should be a lot of time for questions, so please feel free to jot down any thoughts you have or put your questions into the Q&A. But before I move on to these topics, I wanted to take a moment to introduce folks to OMPRN and this webinar series, which is going to continue over the next 3 weeks. So for those of you who are unfamiliar with OMPRN, it stands for the Ontario Molecular Pathology Research Network. We are a network of pathologists, researchers, and educators who are dedicated to improving the use and understanding of molecular pathology in cancer care. This webinar series is part of our commitment to patient-oriented education, which, as Harriet said, is an area that has grown a lot for us over the last few years. And one of our goals is to make complex medical topics a bit easier to understand and also to have fun while we're doing it whenever we can. We have a lot of resources on the OMPRN website that patients, their families, and caregivers might find useful, and I'm going to mention those a little bit later in the talk. So we are truly grateful to have this collaboration with Wellspring. This is the first session of 4 in our series called Foundations in Molecular Pathology from Cancer Origins to Diagnosis. The series is going to explore the science behind cancer and how molecular pathology helps with the diagnosis and treatment. It's also going to cover topics to help patients better understand their diagnosis and to be active participants in their care. You'll notice as the series goes along that each of the sessions is built on the one that came before it, and recordings are going to be available through the Wellspring website in case you miss any of the sessions or you wanted to revisit any of the topics that were discussed. We've all heard the saying that knowledge is power, and through this series and the resources on the OMPRN website, I really hope that we're able to provide you with the knowledge and confidence that you need in order to have more informed conversations with the folks on your healthcare team. So let's move into the main topics for this presentation, which is about how cancer starts, how it spreads, and the importance of early detection. Before we talk about how cancer starts, I thought it would be good to define, for the purposes of this presentation, what cancer is. So to put it fairly simply, cancer is a disease where cells in the body start to grow in an uncontrollable way. At a certain point, these cells might also spread to other parts of the body in a process called metastasis. So now that we have the basic definition of cancer and metastasis, we can start working backwards and figure out where cancer actually comes from. And many of you might already know this, that cancer actually comes from, it actually starts off as a normal cell. So healthy cells in your body, they are used to following these strict rules when it comes to growing and dividing. So for instance, when a normal cell becomes old or damaged, it dies and is replaced by a new cell in a very orderly fashion. And the reason that your cells know when to divide and when to stop dividing is because their genes tell them to. So genes are the instructions in our DNA that tell our cells how to grow and function, basically. Cancer, on the other hand, is caused when there are changes in our genes. So when these instructions are changed, cells can really grow out of control, and that's when you get the formation of a tumor. So I think one of the ways that we could think about it is that cancer development is like a traffic system. Normally, your cells have these traffic lights that they follow. That'll tell them when to grow and when to stop. But if those traffic lights break, the cells can keep growing, and that's how a tumor can form. So before I move on, there are a few key things that I want you to know about gene changes. The first is that gene changes don't immediately result in cancer. In fact, it can take years or decades after a gene change occurs for cancer to develop and to be noticed. Another is that not all gene changes are going to lead to cancer. Some changes are completely harmless, while others allow cells to keep growing and dividing when they really shouldn't be. And lastly, not all tumors are cancerous. There are benign tumors that grow a bit more slowly than cancerous tumors and won't necessarily spread to other parts of the body. I should mention, though, that certain types of benign tumors, if they're given enough time or the right conditions, they can actually become cancerous. So now that we talked a little bit about cancer and where it comes from, we can talk about how cancer spreads. So when cancer stays in one place, it's referred to as a localized tumor. In some cases, cancer can spread from the primary tumor to other parts of the body in a process called metastasis, as I mentioned before. When cancer does spread from its original site to other parts of the body, it becomes much harder to treat. And on the next slide, I'll show you how metastasis can be broken down into smaller steps. So on this slide here, let me pull up my pointer. I'm showing the primary tumor that you can see here, and this is the site where cancer first develops. In some cases, cells can break free from this tumor and start to invade surrounding tissues. a small number of these cells can actually invade nearby blood vessels and enter the circulation system or the circulatory system. And once they're in the circulatory system, they get pumped through the body, and they're able to travel to distant organs. Eventually, some of those cells might exit the bloodstream in those organs, and if the conditions are right, they can begin growing and form a new tumor, which is a metastatic tumor. And because cancer cells can grow and spread in different ways, and it's important for diagnosing and treating the disease to be able to talk about the ways that cancer is growing and spreading. Doctors use a staging system to talk about how advanced cancers are. So here I'm going to talk about a brief overview of cancer staging. So basically, a staging system tries to answer two questions. One is how big the tumor is, and the other is how far it has spread. There are a lot of different cancer staging systems, and there is no one system that covers all types of cancer. And there are even certain cancers that have their own unique staging systems. But there are two very common staging systems for solid cancer that you might have heard of. One is called the TNM staging system, and the other is called stage grouping. In the TNM system, it stands for tumor, node, and metastasis. And the questions that the system asks are how big is the primary tumor, whether it's spread to nearby lymph nodes, and whether it has spread to distant sites. One of the things about the TNM system is that it can be a little bit detailed, and it often shows up in pathology reports or research studies. For anyone who wants a little bit more information about the TNM system, we actually have a really nice video lesson on our website about that. The staging system that I want to focus a little bit more on is the stage grouping system, which is a simpler version of the TNM system. And it is the way that patients are more likely to speak to their oncologist and other members of their healthcare team about cancer. So this system still asks the two important questions. So how big is the tumor and how far has it spread? But it's a little bit easier and more intuitive to understand. In stage grouping, the stage goes from stage 0 all the way to stage 4. And the higher the number, the more advanced the cancer. Stage 0 can be considered the earliest sort of stages of cancer or pre-cancer. What it essentially means is that there are unusual looking cells that are present, but they haven't spread at all. Some of you might have heard about the term carcinoma in situ, and this would be considered stage 1. I should mention that depending on the type of cells that are involved, a stage 0 cancer or stage 0 tumor can become cancer at a later time. Stages 1 to 3 generally mean that cancer has been detected and is present, and that the tumor is still fairly localized. As the number increases, it means that the tumor is becoming larger, more advanced, and is starting to spread to nearby tissues. And by stage 4, the cancer has already spread to distant parts of the body. So that is an overview of the two most common staging systems, as well as this stage grouping system that you might be more familiar with. So now that we've discussed a little bit about how staging works, we can move on to why it matters. So first, staging helps doctors to decide on the best treatment approach. In general, early stage cancers are often treated with localized treatments like surgery or radiation. And the reason that this works is because the tumor is confined to one part of the body at an early stage. More advanced cancers might require systemic therapies like chemotherapy or immune therapy, and mostly because the cancer has spread by this point. And knowing the stage of cancer is important because it ensures that patients get the most appropriate and effective treatment for their condition. A second important benefit of cancer staging is that it helps doctors predict how a tumor might behave over time. It also gives patients a sense of the overall trajectory of the disease, and which can be very important in helping to plan out treatment. And finally, cancer stage is a key factor in determining or knowing whether a patient is eligible for a clinical trial. Clinical trials often look at how a new drug or treatment works on a certain type of cancer at a specific stage. For patients who don't respond to conventional treatments, clinical trials can represent a promising option and might be worth discussing with the folks on your healthcare team. So in the last set of slides that I have here, I want to talk a bit about early detection and why it matters. So one of the key differences between localized tumors and metastatic tumors is time. And I've mentioned it before that cancer that is detected at an earlier stage is easier to treat, and the chances of successful treatment are going to be much higher. So this highlights the importance of screening tests like scans and colonoscopy, for example. But there is a new type of test called liquid biopsy that uses molecular pathology to try to catch cancer before it spreads. So liquid biopsy is a non-invasive test that looks for cancer biomarkers using a sample of fluid from the body, like blood, most commonly, or even urine or saliva. And a biomarker is a chemical or a molecule in the body that gives us a clue as to what's happening inside. You can think of it as a signal that doctors use and that they can measure and use to help make a diagnosis of a disease or to see how a treatment plan is progressing. Next week's speaker is actually going to touch a little bit more on biomarkers and liquid biopsy when she talks about what is molecular pathology. So stay tuned for that. But if you wanted a little bit of a preview of those topics, we have some lessons on the OMPRN website in our patient education section that you might be interested in. So to wrap up, so here are some of the key points from my presentation that I wanted you to remember. I've explained that cancer starts when there are gene changes that occur in normal cells. I mentioned that cancer can spread through the process of metastasis, and also that early detection can improve outcomes. Future talks in this series are going to explore more about how molecular pathology is involved in cancer diagnosis and treatment. Okay, so before we get on to the Q&A and the discussion, I thought it would be nice to see how people feel after this presentation and what you've learned. Hopefully, some of you feel more empowered after listening to this presentation. So we're going to do a little bit of a Zoom poll here, and excuse me while I try to get this going. Okay. So you should see the Zoom poll on your screen now. It's just one question. The question that I'm asking is whether you feel more comfortable discussing cancer science with your doctor after today's session. So the options are yes, much more, a little more, no, it's still too complex. Okay. Alrighty, so we have most people responding here, and the most popular answer choice is B, a little bit more, with 67% of the votes. Yes, much more, with 31% of the votes, and no, it's still too complex, with 2% of the votes. And you should be able to see that on your own screens now. So thank you for your responses. For the folks who need or feel like they need a little bit more support for having those important questions, or sorry, those important conversations with your healthcare team, I would encourage you to visit the OMPRN website and look at some of the resources that we have available for patients. I'm just showing the titles of a few of the lessons that we have that cover some of the topics that we talked about today, and there are a lot more lessons on the website that you might find interesting. So before I open up the floor for discussion, I want to thank a few people. I'm really grateful to Vinitha and all the folks at the Wellspring Cancer Support Foundation for giving OMPRN the opportunity to present as part of the Be Well Talks. I'd also like to thank the speakers of upcoming sessions in advance, especially I really think you're going to have a great time meeting them and learning from them. In next week's presentation, Dr. Rolis Alib is going to talk a little bit more in depth about molecular pathology itself, and she's going to talk about those topics I mentioned, like liquid biopsies and biomarkers. I'd also like to thank the members of my team, the OMPRN director, Dr. Harriet Feilotter, as well as our patient and partnership lead, Leanne Van Strip. She was very instrumental in helping to put this presentation together, as well as putting together the entire series. And finally, I'd like to thank everyone in the audience for taking the time to attend and for listening as well. So now I'd be happy to take any questions that you might have.